So exciting times to see new recommendations, the publication of the ADA EASD recommendations for the management of type 2 diabetes. As a proud Canadian from having worked with Diabetes Canada, we are very similar, and that means that we're both on the same track. One of the things that's been really called out in the pharmacological chapter in our guidelines, and also is very present in this paper, is the idea of patient-centered care, about goal setting, about collaborative decision-making and shared decision-making. There's also a focus again on healthy lifestyle intervention, so discussion about the important things that matter, things like nutrition therapy, individualized, especially in today's world when there's all kinds of different dietary patterns. There's some very good recommendations about what exercise should look like, because we often have difficulty with that. And then I think the other thing that's very interesting is the call out for the need for self-management education and support. We recognize that we have not done a good job with that anywhere in the world, and so this paper also calls that out. In terms of the actual management of diabetes, again, very similar. We now have this consistent messaging around individuals with previous cardiovascular disease and the utilization of SGLT2 inhibitors and GLP-1 receptor agonists with proven benefit. I found it very interesting to see a column for those with previous CKD. We have a suggestion in our guidelines, but there's a definitive path in this set of guidelines. Perhaps they're looking forward to the future, but based on the data, the subset of data from both the Canvas program as well as the EMPA-REG program, there's a definitive call out there. And I think after that, the algorithm itself is again quite simplistic, with the hierarchy of choosing medications based on safety and efficacy. So again, a specific call out to, yes, of course, glycemia is important, but after that, let's make sure we deal with weight. Weight is important, hypoglycemia is important. So our new composite endpoint. And then as it goes through the recommendations for therapies after metformin, there is a higher call decision based on the drug which is most efficacious in that class and has the best safety profile. So I think this is going to be an excellent document to help individuals manage type 2 diabetes, but I'm particularly pleased with the call out for the need for self-management education and support. Congratulations.